Hello, my friends. Hope you are fine. Have you ever left a doctor's office feeling fine, maybe even relieved after a routine checkup, only to suddenly feel dizzy, confused, or even experience blurry vision days later? It sounds unthinkable. Right, you did the responsible thing. You went for your tests. You followed the doctor's advice. But what if I told you that some of the very medical tests designed to keep you safe, especially for seniors, could quietly raise your risk of stroke? I know it's hard to believe, but for millions of older adults, that silent danger is real and it's hiding. In plain sight every year, seniors across the country walk into clinics and hospitals, believing they're staying ahead of health problems. And while that's true in many cases, not every routine test is as harmless as it seems. Hidden within the fine print of modern medicine are overlooked risks that your doctor might not mention, that pamphlets in the waiting room won't explain, and that news headlines rarely cover. Some of these tests, especially when given to older adults with high blood pressure, heart conditions, or kidney issues, can silently disrupt blood flow, spike blood pressure, and yes, even trigger strokes. But this video isn't meant to scare you. It's here to empower you with the truths so you can make better, safer decisions as you age. Because once you're over 60, healthcare isn't just about detecting problems early. It's also about avoiding complications we never saw coming. So, let's walk through the 5 most common medical tests that can carry hidden stroke risks for older adults and, most importantly, what you can do to protect yourself. Let's start with a familiar one: the CT scan with contrast. If you've had one, you probably remember that warm rush that moves through your chest. That's the contrast dye. It helps doctors get a clearer image, but here's what most people don't know. That same dye can silently strain your heart and blood vessels. If you already have high blood pressure, heart disease, or kidney problems, this added stress can lead to dangerous drops or spikes in blood pressure. Some seniors report nausea, lightheadedness, or fainting. And in rare cases, this pressure swing can lead to a stroke. One major study found that seniors were more likely to experience vascular complications within 72 hours of having a contrast-enhanced CT scan, especially those with underlying health issues. Take the case of an 81-year-old man who felt perfectly fine after his scan, until he suffered a minor stroke just 2 days later. Doctors believe the contrast dye likely spiked his blood pressure just enough to trigger the event. What should you do? Ask your doctor. Is this scan essential? Can we do it without contrast? In many cases, a non-contrast CT or even an ultrasound can offer the information your doctor needs without the added risk. Next, let's talk about the cardiac stress test, often done on a treadmill while your heart is monitored. It sounds straightforward. Walk or jog, get results, go home. But if you're over 60 and living with heart issues, this test can do more harm than good. It can raise your blood pressure rapidly, cause irregular heartbeats, or put unexpected strain on your cardiovascular system. A 2020 study found that 7% of seniors experienced harmful effects during these treadmill stress tests. One viewer, Igret, age 74, took the test and felt dizzy halfway through. The next day, she had a minor stroke. Doctors didn't blame the test directly, but it clearly pushed her body past a limit it couldn't handle. What can you ask instead? Is there a safer way to evaluate my heart? You might consider alternatives like a nuclear stress test or a resting echocardiogram, which often provides similar insights with far less risk. Another common test: the endoscopy, used to check your stomach, esophagus, or colon. These are often recommended after age 60, especially during routine screenings. But here's what's often overlooked: the sedation used during these procedures can drop your blood pressure and interrupt normal blood flow, especially if you're on blood thinners like aspirin or Plavix. A 2021 review showed that transient ischemic attacks or mini strokes were more common in seniors. Within 72 hours after sedated endoscopies, one 76-year-old woman had a routine colonoscopy and felt fine at first. But 2 days later, she slurred her speech and had poor coordination. Doctors confirmed she'd had a mild stroke. The combination of blood thinners and sedation likely led to the drop in pressure that triggered it. So, ask your doctor, do I truly need this test now? Can it be done without sedation? If you don't have symptoms or urgent issues, there may be other, less risky ways to keep an eye on your digestive health. Moving on. The MRI with contrast, commonly used for back pain, brain scans, or internal injuries. These tests often involve gadolinium, a heavy metal dye that helps highlight tissues in the scan. But gadolinium is flushed out by your kidneys. And once you hit your 60s, your kidneys don't always work as efficiently if the dye stays in your system too long. It can cause dizziness, brain fog, and, in rare cases, a condition called nephrogenic systemic fibrosis, serious problem that affects the skin and organs. A 2019 study found that 5% of seniors experienced stroke-like symptoms after contrast. Especially those with kidney conditions. Harold, 79, went for a scan after some back pain. What he didn't know was that he had undiagnosed kidney disease. After the scan, he felt weak, foggy, and unsteady. A blood test revealed his kidney function had worsened. What can you do? Before any contrast MRI, ask for a kidney function test called a GFR, and always ask if a non-contrast MRI can work instead. In many cases, it can dot finely. Let's talk about the carotid artery ultrasound. It checks for plaque buildup in the arteries that send blood to your brain. Seems smart, right? But if you don't have any symptoms like dizziness, memory loss, or vision issues, this test can lead to unnecessary surgeries. Research shows that even if your artery is 60% narrowed, surgery may not reduce stroke risk more than medication and lifestyle changes. And the kicker: some patients actually have strokes during or after the surgery itself. Take Helen, 82. After a routine scan showed some narrowing, her doctor recommended surgery. But during the procedure, she had a stroke and now lives with permanent weakness on one side. So before agreeing to surgery, always ask, will this scan change my treatment plan? Is there evidence that surgery will reduce my risk? Sometimes a second opinion can save your life. So here's the bottom line. Not every test is bad, but not every test is necessary. Once you reach your 60s and beyond, your body responds differently to stress, sedation, and medical interventions. A test that's routine for a 30-year-old might carry real risks for someone older. That's why it's so important to speak up, ask questions, and make informed choices. Next time your doctor recommends a test, ask, is this really needed? Are there safer alternatives? Because your health story is yours too, right? Your voice matters. If you've ever felt strange after a medical test, or if someone you love has, drop a 1 in the comments. If you haven't, drop a 0. And if this video helped you feel more informed, more confident, or more in control of your health, subscribe to the Elderway. This is where truth meets care, and your well-being comes first. L-being